Recreational use of illicit fentanyl is on the rise. This addictive drug is gaining more users, ruining more lives, and leading to more fatal overdoses. Fentanyl, the buzzword of the opioid epidemic sweeping the United States. This potent drug has risen out of relative obscurity to being planted firmly in the spotlight, dominating headlines from coast to coast. It is reported that in 2017, more than 70,237 fatalities were the result of drug overdoses in America. Of these, over 20,000 of those deaths were because of fentanyl alone. In its intended form, fentanyl is an opioid medication used to treat severe pain. Researchers place it as being up to 100 times more powerful than morphine. Fentanyl is anywhere from 30 to 50 times more potent than heroin. Fentanyl overdoses showcase a set of symptoms similar to all opioids. Though these are more pronounced and frequent with recreational misuse, such symptoms are possible with medical-grade fentanyl use as well. Overdose symptoms include dizziness. It will be difficult to remain steady and upright during such an overpowering overdose. Confusion. Victims may be unaware of their surroundings, perhaps even unaware that they consumed fentanyl. Body weakness. Fatigue is common. Extremities may exhibit limpness too. Sleepiness. Lack of proper oxygenation can lead to feelings of drowsiness. Hyperventilation. Slow breathing as opposed to rapid, erratic breaths. Opioids such as fentanyl act upon the centers of the brain that control respiration. The signs of a fentanyl overdose mirror that of its symptoms. Keep a keen eye on a suspected victim. Seek out medical intervention when the following signs begin to surface: pinpoint pupils, lethargy, slow heart rate, low blood pressure, blue-colored lips and fingernails, clumsiness, and unconsciousness or coma. Any apparent loss of consciousness should be acted upon immediately. Apart from that clear and present danger, each of the other signs should be red flags to any observer as well. To someone witnessing a fentanyl overdose, the most striking sign that something is amiss is the bluish color of a victim's lips. From here, their body will likely seize up and remain rigid, similar to rigor mortis. When help arrives, EMTs and law enforcement will administer naloxone, an anti-overdose drug designed specifically for opioids. Naloxone blocks the receptors that opioids bind to in the central nervous system. It functions as a suppressive measure rather than an antidote. However, one dose of naloxone may not be enough, and multiple doses may be required. Once a person has been stabilized, physicians can continue treatment at the hospital and address any life-threatening breathing or cardiac issues. Drug overdose can be fatal. If you suspect someone is experiencing an overdose, call 911 immediately. Do not be afraid to seek help. If you do not have access to a phone, contact Poison Control Services for online assistance. Don't let a fentanyl addiction claim your future or that of someone you love. If you or a loved one is facing opioid addiction, the Recovery Village can help. Call our recovery advocates at 855-239-9898 to get connected to life-changing rehab treatment.